Gives me great pleasure to introduce to you Professor David Gilchrist, which I will do in a moment. In thinking about what David is going to be sharing with us, many of us would be familiar with, I think, the term no margin, no mission. And I did a little digging as to where this term was first coined. And it turns out it was coined in the mid-1900s by Sister Irene Krauss, a Catholic sister who became president of a network of more than 80 non-profit hospitals. As leader of the organisation, she extolled the benefits of fiscal responsibility in healthcare. In her eyes, a threat to a hospital's financial health was also a threat to its core mission. And we certainly heard from Kathleen this morning in her presentation regarding those two things. I'm a little like Alice. I just assumed when I heard the term margin, it was more in the context of the way in which we employ it in Catholic social services to reach out to or work with those who are on the margins, but clearly it's not quite that. Today, David will be addressing with us Social Services Sector Report and launching that report for us, and the work that the University of Western Australia have done, particularly the Centre for Public Value, of which David is the director. David has worked in and around human services sector for 30 years. He's held executive roles in, consulted to and been part of a governance team of various charitable human services organisations, including disability services, aged care and child protection. In all of these areas, David has contributed to policy and practice. Prior to joining the Academy, David was Assistant Auditor General for Western Australia and has taught at the London School of Economics and the Portsmouth University in the United Kingdom, and Curtin University and Edith Cowan Universities here in Australia. He was the National Associate Dean of the Business School at Notre Dame, where he was also an adjunct professor of not-for-profit leadership. David has researched in the areas of non-profit sustainability, economics and governance, and has written over 100 industry reports and papers focusing on key issues related to the sector. David was made a Fellow of the Parliament of Western Australia in 2021 and received a Meritorious Service Award from the Chartered Accountants Australia and New Zealand in 2024. Please welcome, ladies and gentlemen, Professor David Gilchrist.
Thank you. Thank you very much for that generous introduction, and also thank you to Catholic Social Services Australia for putting the accountant on halfway through the day. Normally I get the Friday afternoon slot once most of the crowd has exited the building, so I'm really pleased to actually have a real live audience to talk to rather than just key friends that have hung around for me. It is a really fantastic opportunity to be presenting this report for a number of reasons, not least of which because the support that Catholic Social Services Australia has given to the University of Western Australia, and particularly my centre, the Centre for Public Value, has been absolutely incredible, not just in terms of financial resources, but also in terms of time and commitment to the development of the outcomes associated with this report. The report's also really important because we've been examining the financial sustainability of the human services sector or social services sector or community services sector, however you want to phrase it, for almost 20 years now at the University of WA and at Curtin University before that. But all of those studies have been very much focused on the population level data and population level findings. This report is a really important report and an important study because for the first time we're actually digging very deeply into the financial sustainability of specific organisations and looking to understand what's really driving financial sustainability, or in this case I have to report unfortunately what's driving the financial sustainability challenges that are faced by these organisations. So this report reinforces what we've found in many other exercises, but importantly really gets to the nub of what the costs are that are changing over time and what the impact of those changes are in the context of government policy for funding and for indexation in relation to human services. So I think this is probably one of the most exciting reports we've had the opportunity to write and to develop, and it will go on and inform a lot of research, not just with the Centre for Public Value, but we've also seen a number of other universities pick up this research and start to move forward on it, which I think is a really exciting proposition for everybody. So the report itself is available online. There is a set of links at the end of this presentation, and I will make these slides available, so don't feel that you have to take photos of them or write down facts. Those slides will be available to everyone. But essentially, this report is a critical report because, as I said, it focuses on these specific organisations and actually gives us an understanding of what's driving real sustainability challenges for specific organisations in specific locations. My agenda today is to give a brief overview, if you like, of the project itself, to talk about the key findings that we've identified and what they might mean, to talk about the systemic problems that they represent, and also then to propose a bit of a way forward. We've also set up 15 minutes for Q&A. I'm really happy for people to interject. That's no problem at all if you've got a question, preferably that's relevant to the subject, but I'm happy to take any questions at this stage. But also, if you've got some key questions, if you're happy to wait until the end, we've got that 15 minutes, as I say, to be able to move forward. Before I get into it though, I really want to make a number of statements that our research has found over time, and this research has reinforced very, very clearly. And if nothing else from this presentation, even if nothing else from this report, I'd love you to take these statements back to your organisations, back to your communities, and to be advocating these statements in the context of those communities, because I think one thing that this report and other reports that we've undertaken and reports undertaken by many other academics around the country show quite clearly that we have to be talking to our communities to appraise them of the challenges that the sector has and to appraise them of the reason the sector is so important to maintaining and developing a country like Australia, one of the wealthiest countries in the world, and yet one of the countries with some of the most extreme social services challenges in terms of supporting those people who are much more vulnerable. So to that extent, there's a couple of issues that I think are the point, and I'd like, as I say, to be able to communicate these first and foremost. I think the very first issue is that government funding policies are crippling social services sector. I don't think there's any doubt about that, and again, I'll talk to that as we go through the presentation. I think service providers do not recover their costs in their comprehensive cost of service delivery. And I'll talk to that a little bit more specifically and a little bit more nuanced. But at the end of the day, without getting too accountified about the whole thing, at the end of the day, organisations must make a margin, as we've just seen, in order to be able to do their work. And I guess no margin means that there's actually more margin if we take up that definition of what the margin might mean in social terms. Service providers' capacity to invest for policy change, training and renewal is negligible. They don't have the capacity to be able to meet government policy changes, don't have the capacity to be able to meet economic and other impacts that drive the sustainability challenges that they face as organisations. And again, I'll talk to that shortly. I think the other thing that's not often recognised, and certainly has shown up in this report process, is the fact that taxpayers pay more as a result of governments mistaking cheap for efficient. Cheap and efficient are not synonyms. And at the end of the day, we need to have efficient services. I don't believe there's anyone in the room that would see taxpayer dollars misspent or misallocated. But cheap doesn't mean that we're being efficient in what we're doing. It doesn't mean the outcome's being achieved. I'll also just say at this point that when I talk about governments, I'm talking about all of the governments in Australia. I'm not just picking on the Commonwealth or picking on particular states and territories. I'm talking about governments generally, because the government policy frameworks are the same replicated throughout the jurisdictions. I also think there's a lack of transparency, which means that service mix shrinkage, so the services that are being delivered actually goes unnoticed. And this is a really big issue for the community who are trying to make decisions about whether or not the NDIS is actually too expensive for the country, or whether or not we should be allocating more funds to social services or less funds. I think it's very difficult for voters to be able to make that decision when we actually don't have any data about what the need is in the community, what the cost of meeting that need is, and what the gap might be if we don't actually achieve that outcome. These are all within our technological ken to be able to understand what these things are, but we certainly don't have transparency over them. The final point that I think is really, really important is that this is not about the social services sector to me. At the end of the day, the people that actually are the shock absorbers for failure in the system are the service users themselves. So the most vulnerable people and the most vulnerable communities in our country are the ones that actually wear the poor policy outcomes. The charities and the not-for-profits, by and large, survive, but the service delivery component is the real issue. How do we actually make sure the right services are delivered to the right people? So I wanted to make those points up front, as I say, because that will frame the kinds of discussion that I hope to have today, and to give you a sense of a better sense perhaps of the outcome of the evidence, and also in relation to the kinds of solutions that I think are important for us to be grappling with going forward. So, first and foremost, I think it's really important for us to have a mutual understanding as to what sustainability is. And this is set out in the report really clearly, I think. But at the end of the day, there are essentially two forms of sustainability that we might talk about. We might talk about macro or system sustainability, whether the system is delivering the services that need to be delivered in all the right places at all the right times. We also talk about micro or organisational survivorship, so specific organisations surviving. Our report looks at specific organisations, but we're using those specific organisations as foils to understand better the macro or system sustainability. So in our centre, we don't look at individual organisations per se. We're not worried about individual organisations per se. We're worried about the system being able to progress to be delivering those services. So to that extent, all of my comments and all of the things that we report on in this document relate to the macro or system sustainability. I guess the second element there then is to have a mutual definition of what sustainability is. And sustainability at a systemic level is the capacity to maintain the service mix. The service mix is all of those services that need to be delivered to meet need in the community. It's a simplified and, if you like, aggregated view of how we might approach our definition of services, but our centre believes, and our evidence strongly supports, the idea that service mix is actually the correct view or the correct lens through which we should look at sustainability, and through which we should look at whether or not sufficient resources are allocated to this particular sector. To that extent, to maintain the service mix, we need to be able to ensure that on an ongoing basis, organisations are able to present the same quantity of services as are needed in their communities, at the same quality that is needed. And we're not talking about hot and cold running champagne, we're talking about quality in terms of the service delivery requirements, and at the same timing. Without those three elements, there is no such thing as system sustainability or service mix sustainability. And while organisations might survive by pulling the one lever they really have, and that one lever is to be able to reduce the quantity of services that they deliver, at the end of the day, that doesn't result in the outcome that we're all looking for, which is the delivery of the necessary services into the community. To that extent, then, the comprehensive cost of service delivery is what we should be focusing on, reporting against and understanding in the context of accounting for the funding requirements of this particular sector. So the comprehensive cost of service delivery is all of those costs that relate to the delivery of services, including overheads, including long-term costs, so being able to maintain medium-term and longer-term sustainability as organisations and as a sector. So the service mix then, as I said before, is the appropriate lens through which we should be judging sustainability, and we should be judging particularly government funding policy in support of that particular outcome. Okay, so some of the other things that I want to talk about include the context. And so to that extent, in terms of taking a systemic view rather than an organisation view, taking a service mix view, I think there's a couple of further things that we need to be aware of before we get to the evidence side. And I can feel the electricity in the room as I start to talk about evidence and research and finances and so on. One of those things is that in this country we talk about demand and we plan based on demand, and demand and need are two different things. In economics, we talk about demand being created by the purchaser or by the buyer, by the supplier. At the end of the day, the demand figures that we often talk about in policy circles relate to how many, to use a business school phrase, widgets government is buying, as opposed to how many, to use that business phrase, widgets we're actually needing in the community. At the moment, we really don't have an understanding of the need in the community. We have an understanding of demand because that is, by definition, the amount of services government's prepared to buy. But we don't understand need, and we think we need to understand need before we can have an appropriate funding policy put in place. We also see that government's prioritisation and resources accountability is absolutely central here. This is the government's responsibility, and I'll talk to that shortly. You'll be surprised to know I've only got about 87 slides, so we'll be out of here before you know it. But at the end of the day, one of the things I want to talk about is the fact that this is actually the government's responsibility, and I want to demonstrate why that is. The other element that I think is really important, I've already indicated, is that efficiency and cheap aren't synonyms. And going for the cheap option actually results in government paying more, taxpayers paying more as a result of not getting the services undertaken correctly at the correct investment up front. It also results in government's costs going up, but it results in cost shifting between jurisdictions and between departments, and I'll talk to that a little bit more deeply. But at the end of the day, government's costs go up because social services aren't provided. That means people end up, for instance, in the primary healthcare area, which I'm sure many of you have had experience of. In the primary healthcare area, beds are taken up, which means that people that need beds in hospital don't get them, but it also means governments pay much more for services being delivered than they pay when they have those services delivered by the very cheap social services sector here in Australia. So I think there's those government costs that are hidden. There's no transparency around those costs, which is really important to remember. The other insidious thing that happens in a set of jurisdictions like the Australian Federation is those costs also shift. The Commonwealth Government doesn't care if it can shift costs to states or territories. The states or territories don't care if they can shift costs to the Commonwealth Government. But at the end of the day, guess who writes the cheques for all of those costs? It's the taxpayers. So we need to have transparency over what those alternative services cost, what those transitions or transmissions of cost between jurisdictions cost, and look at transparency over how governments can be accountable for that outcome. So that lack of transparency then I think has a number of impacts, but one of which is we can't identify the service mix gap, the gap between what is provided and what is needed in the community. And we're certainly not saying that government should simply get out its chequebook and close that gap. But how can we have policy? How can we respond effectively if we don't have an understanding of what that gap is? That surely that's the first strategic piece of information we need in order to make decisions across all aspects of this particular policy area. We also don't know what the comprehensive cost of service delivery is. We don't create our funding policies or the funding amounts, the prices that we're prepared to pay in governments for services based on what it costs to deliver services. We base those prices on the historical appropriations that have been made in this area and the amount of money that's left over to be able to buy those services. There's a significant dislocation between what it costs and what's actually paid for it. And of course, we don't have transparency, as I mentioned before, about the delivery, the cost shifting and cost shifting within jurisdictions, cost shifting between jurisdictions that also cost taxpayer a lot more. So let's get to the project then. I know you've all been pretty excited to wait to hear about the methodology and so on, and I think we're at that point. So the project was a case study project. We looked at specific organisations, in fact 7, that were located variously around Australia that provided services in metropolitan areas as well as in rural and remote areas. Importantly, those social service organisations were chosen not because they had a particular financial outcome. We didn't investigate or look at their finances until after we'd chosen them to participate in the study. I think that's a really important point to make. But we chose them for their geography and for the types of services that they delivered to try and get a mix of those two things to see whether or not geography and service type had an impact on the outcomes that we were looking to achieve. Importantly, all of those organisations were members of Catholic Social Services Australia, and we really thank those members for their time and effort. Participating in a study like this is not easy. Every organisation has more than enough to do. They don't need someone from a university asking them to fill in very, very significant forms of giving us detailed data, and so we really appreciate them contributing in that respect. The data that we looked at was relating to the 21-22, 22-23 and 23-24 financial years. So with 7 cases, it meant that we had what we call 21 observation years, so 21 years that we could examine in relation to the way costs were impacting these organisations. We also had costing and activity data, so we asked them questions about how they costed, but also questions about what kind of activity they undertook, what kind of services they provided, and what the changes in those activities were over the time that we were undertaking this study. We asked for qualitative data, asking these organisations to answer particular questions that helped us to understand a number of aspects of their accounting processes and also their financial sustainability impacts. Importantly though, I think there's a few things you should note. In relation to this group, they are separate cases. We can't aggregate or extrapolate from these cases, but I do want to say and emphasise that these cases reinforce population level data that we've identified in other studies. So even though this study is very much looking at individual organisations and the experience of those organisations, I have to say that experience is replicated at the population level. But we can't say, hey, this report says these things, therefore that applies around the country. We can say that this report says these things, and that's the same sort of experience that we're seeing elsewhere in the sector. The other thing to note is that the financial reports that we used, the financial information, was all assured. So we had a little bit of a time crunch on this project because we wanted to get the latest data we could, which was the 23-24 financial year, and that meant we couldn't collect data until October because we wanted that data to be assured by auditors before it came through to us. So there has been assurance over that. The other thing to remember is that all of these organisations are large according to the ACNC scale of small, medium and large charities. So number one, they're all registered charities. Number two, they're all large. But actually the mix of organisations means that the smallest organisation turned over about $5 million and the largest organisation turned over $100 million. So even though they're all technically large in the ACNC sense, there is a spread of turnovers that I think makes a difference to our understanding of those organisations' financial sustainability. The total turnover of these organisations then was 359 or 360 million in round figures. The self-generated income was about 6.75%, and I'll have some words on that shortly. The total FTE was about 3,000 people. The total volunteers, interestingly, was about 500 people for these organisations, and one of the side issues is that volunteering hasn't really recovered since COVID for many organisations, and that's been reflected in this data as well. I'm really happy to take queries regarding method and data during question time if people would like to have those queries, but I'm also happy to take it out of session. If you've got any questions or comments, I'd love to talk to any data heads about how we put this together. I'm really happy to be contacted, and my contact details are at the end of the slide. So what did we find then? So firstly, I want to say we examined these 7 organisations with a view to sheeting home the problem. Was the problem in relation to the organisations and their efficiency, their attitude, their processes, their experience and so on? Was the problem a government problem, or was it a mix of things? And essentially we found that it was a government problem, a government funding policy problem. We use a thing called the Herfindahl-Hirschman Index. We call it the HH Index because I can't spell it, and I'm thrilled that I was able to pronounce it in this austere company. But the HH Index is an important index that gives us a sense on the diversity of income sources for an organisation. And we apply that particular formula, and I'm again happy to share the formula and the process, that gave us a sense of the diversity of income sources for these organisations. That 75% there says that the highest diversity, rather, for the cases that we studied was an organisation that relied 75% on government, 25% on other income. That was the highest diversity that we've found. We're currently running that data through the ACNC database as well to see what that checks out like across the whole ACNC, and I'll be delighted to report back on what that looks like. My gut tells me that 75% will actually creep up. In other words, government is actually more important to these organisations than other sources of income. In terms of cases, though, we found, for instance, the government's reliance index, so this is a formula that we use to work out specifically the extent to which organisations are reliant on government funding. You can see case 1 relies to the extent of 98.8%, so it's virtually almost 100% reliant on government. Case 6 relied on government to the extent of 90%, and other organisations stretched between the 75 and that 90%. What you might say then is, well, why aren't these organisations accruing income elsewhere? Why aren't they going elsewhere to get income if the government's not providing them enough income? And if we set aside the obligation of government to actually support the community and do all the things that we've just, for instance, heard need to be done across a raft of social services, at the end of the day, we also saw some really interesting statistics on some cases. For instance, case 2 had income, commercial income, fall by 72% over the period that we examined this organisation. So the organisation had some income coming in from commercial activities, but that income fell by 72%, which means it's unreliable income for the organisation in terms of being able to provide those services. We also saw in case 5 donations fall by 75%, and this was a much more normal response for these cases, and incidentally that is also the kinds of data we're seeing out of other studies that look at a population level. Donations are unreliable, they can't necessarily be garnered, and in the case of bequests we're actually seeing, this is other studies, but in the case of bequests we're actually seeing that organisations are collecting about 30% of the bequests that they have because family are increasingly less satisfied that some of mum and dad's assets go to charities. So one major thing that came out of this project was the fact that the cases couldn't rely on external income outside of government to be able to deliver those services. And of course that external income falling away means that services fall away, which goes back to the central premise of this presentation, which is those vulnerable people in Australia are the ones that are actually the shock absorbers for changes in this system. The other issue, though, when we talked more deeply with these organisations about commercial income or donations, is the fact that to obtain commercial income or donations, you have to take significant amounts of leadership time and staff time away from service delivery. You also have to take money away from your balance sheet to be able to invest in these activities. And those activities, again, are not necessarily as reliable as they might seem to be, but more importantly, they deflect the organisation from doing the things that they're there to do in the first place, which again impacts outcomes from a government purchase point of view. The other findings that I think are really important relate to deep dive into the social services costs themselves. And there are a number of things that I'll point out. I can't point out everything. One of the things that we're going to do from these case studies is we'll publish this report today, but we'll also publish individual cases over coming months so that you can see specifically how the organisations went and what kind of deep information might be available through those cases. But just as a little bit of an eye-opener or a set of discussion points. Case 1 had building and maintenance costs increased by 216% during this period. That's not unusual. We all know that Australia, for instance, is in a housing crisis. We all know that there aren't enough trades to go around, and so we would expect that this to be reflected in the costs of building and maintenance for organisations. We also saw workers' compensation expenses go up by 147% in case 2. And this is a really important issue because one of the things that this case reported was that they don't have the capital to be able to employ the people, to be able to put the programs in place, to be able to reduce their workers' compensation premium. So this is why we say that it's not just about the price that you're receiving to cover the cost today, it's about medium-term and longer-term sustainability is critical as well, being able to invest in programs to be able to see the outcome. Case 2 also, and Case 2 kind of features a little bit in this particular portion of the discussion, but interestingly, Case 2 had an increase of 376% in its IT and cyber security costs. This is reflective across the entire sector, and I'm sure most people would understand that that's the case. In terms of IT, it wasn't that long ago that we would go to funders, lotteries, commissions or lottery services to philanthropists to get capital amounts to buy software, and we'd go to the shop, buy the software, load it up onto our systems, and we wouldn't have to pay for that for 5 years or 10 years. Now, of course, we're paying subscriptions for IT, and those subscriptions aren't covered off in the amounts of money that are provided by government to support these services. Cyber security is absolutely critical, as I'm sure you're all aware. Your boards, your CEOs, people are all concerned about inadvertently losing information to cyber terrorists and so on. Case 2 also had a issue, or a demonstrable issue, of quality assurance costs going up by 57%. This is one example of an area where governments put QA processes in place, and we can talk about whether they're appropriate or not, but don't put capital injections into the sector to be able to meet or establish systems for those QA costs, or increase the prices they pay for services to cover those QA costs. All of the organisations had increases in quality assurance costs, but Case 2 was a very substantial increase, as you can see. Case 2 also had an increase in compliance costs. So we often hear about administration overheads. We often hear funders say, well, you can only have 10% for admin or 15% for admin or whatever it happens to be. The fact is admin is going through the roof. It's costing a lot of money to be able to deliver these services and to administrate all of the information and other requirements that there are to meet the regulatory requirements of governments. And in this case, as you can see, Case 2 had an increase of 57.5%. Case 3 costs grew by 22% over the period, while their income grew by 6%. We worked out, and I don't want to, this is a very, very rubbery approximation, but we think it cost them about 5% to do each extra dollar of service that they undertook during this period. They actually paid to deliver those extra services, and I can talk to that in our Q&A process. Case 4, redundancy costs were up 217%. I think this is also a really important issue. Redundancy or changes in human resources obligations with Fair Work Australia and also various states and territories changing the rules to have appropriate job certainty and appropriate job outcomes for people is absolutely critical. But of course there's a cost associated with that, and particularly with uncertain funding arrangements, short-term contracts, it means that redundancy costs and other costs associated with HR go up significantly. And Case 4, as you can see here, had redundancy cost increases. 4 of the other cases had redundancy cost increases as well. Case 4 also showed administration costs up by about 24%, and Case 5 showed IT subscription costs up by 300% over this period. Case 3 had very significant IT costs because they had to have certain IT to meet the contractual requirements of government, but of course they had no capital capacity to be able to put that in place. Case 7 had direct labour costs up by 10% year on year, so each year direct labour costs went up by 10%. And I've got that there for two reasons, I guess. One, of course, is to acknowledge that labour costs have been going up, and I don't think that's news to anyone in the room. But also to remind me that direct labour costs are important, and we always talk about direct labour costs, but actually it's other costs that were really critical to getting organisations over the sustainability line and into unsustainability. So administration, what you might call the small basket of costs. I'll come back to that comment shortly. Further findings included sustainability issues that are associated with the quasi-markets process. Pardon me. In Australia, as you all know, we talk about markets when we talk about this sector. NDIS is probably the most obvious example, but markets idea or faux markets idea is a real nonsense that leads to a number of policy outcomes that are less than satisfactory from the sector's perspective, and particularly from the service user's perspective. So, for instance, case 1, workforce vacancy rates for 21-22 and 23-24 were 47 and 21%. Respectively. What does that mean? It means that case 1 couldn't fill its care worker positions. If it can't fill its care worker positions, it can't invoice government for services undertaken. If it can't invoice government for services undertaken, it can't recover its overheads and build its balance sheet. If it can't build its balance sheet, it can't hire people. If it can't hire people, yeah, we do go right back to the start and go through that circle again. So this issue of quasi-markets and talking about markets rather than having government and the sector working very closely to design services and to support services, and particularly to create a workforce that is going to be sustainable and reliable, is a really significant issue in terms of outcomes for service delivery. Case 2, 61% increase in recruitment costs during that period. And again, for the same reasons that I've just described, that's really important. And in case 4, agency costs grew by 125% in 23-24. And again, for the same reason in relation to that workforce capacity. The other aspect of quasi-markets and competition and all of the things that we've been talking about for the last 10 years in this sector is that marketing costs are also going up. So organisations are spending a lot of money marketing to a need that is more substantial than they can possibly be able to meet, and those costs are going up, as you can see in case 6's case, by 16.3% for that particular period. I think these quasi-market ideas are really debilitating to the sector and debilitating to policy, but also they're just simply misrepresenting what's actually happening in economics in social services in Australia. Again, really happy to talk about that in the questions and answer session. So what were the top 5 expense categories then ranked by growth rate and frequency? IT subscriptions was the first, motor vehicle expenses was the second, and this particularly, of course, was impacted by, or this result was impacted by those organisations that operate rurally and remotely, where some organisations have paid upwards of $3.50 or even $4 a litre for fuel and not compensated in relation to that. Employee recruitment costs we've just talked about, but those have gone up. Regulatory compliance costs have gone up, and client activities. Those were the top 5 expense categories ranked by growth rate and frequency across the population of organisations we examined. Human resources, of course, those costs went up, but they didn't go up as much or as frequently as they did in terms of these top 5 expenses. And again, I'm really happy to talk about that because the proportional impact of human resources cost increases is far different than the proportional impact of these particular costs as well. The other element that's really important is in relation to indexation. And in that case, no organisation reported that indexation met cost increases that they endured. Indexation was inconsistent, so no one could rely on indexation. Typically, they didn't find out what the indexation was going to be for them until very much the first day of the new financial year almost, because at the end of the day, even though governments announced indexation, it's in many jurisdictions it was found that departments didn't necessarily hand on the percentage that the government had announced. So indexation's inconsistent. It's unreliable. We don't know how much we're going to get, but we also don't know what proportion we're going to get in the context of our cost increases. The other aspect, and we've researched this in a number of reports, relates to the appropriation of the indexation models used. And CPI combined with wage price indexation models are simply absolutely inappropriate to indexing costs for social services in this country. It's talking about, on the one hand, what it costs to run a house, on the other hand, applying that cost of running a house to a commercial organisation that operates in a completely different sphere. So I think that inappropriate indexation models is a really important issue, but so too is a lack of transparency. Interestingly, in another project, our centre hasn't been able to replicate the calculation of indexation in any jurisdiction. So we've got indexation announcements of how the indexation is going to go, and then we've looked at organisations in terms of the indexation that they are reporting that they've received, and we haven't been able to calculate back to that indexation model that's been announced. So transparency is a really big issue here. Transparency over when you'll find out, transparency over how we'll calculate it, transparency over how much you'll get are absolutely critical to being able to run your organisation. Now, in the case of case 7 here, cost increases were 13%, 11% for 22-23 and 23-24 respectively, but as you can see, indexation was 1.3 and 5.13% respectively for those years. Went nowhere near to covering the costs that were experienced by that organisation. Now, the other thing about indexation, and I recognise I've only got 1.5 minutes left till we get to question time, and I've got 80 slides to go. We'll get there, trust me, I'm experienced at this, we'll get there. But at the end of the day, I think one of the things that's really important about this indexation issue is the fact that when you are paid indexation, you're actually only brought up to the starting line in the financial year. So your organisation has still got a cash flow cost increases for the following financial year until such time as the price catches up as a result of indexation then. So you're always behind the 8 ball. If indexation's not sufficient, you're increasingly behind the 8 ball. That indexation gap is growing and growing and growing. And again, I keep quoting other studies. You really must get on our website. It's very exciting. Accounting and finance, how can you go wrong? But one of the other studies shows that the indexation gap for the last 5 years in Western Australia, my home state, is about 17%. So even if you had the right indexation on the 1st of July 2025, you've still got that significant gap that is building up. And I think this indexation issue is a really critical issue in that regard. So what does sustainability look like? Firstly, organisations have to be profitable. And as you can see here, out of that 21 years observations, 9 observations were 9 years of losses, 9 profits were less than CPI, and I'll come back to that, and only 2 profits were acceptable in our view, which was that they delivered profits above CPI. CPI we use as a proxy for economic growth. The idea of profit is that you grow your balance sheet. Why do you need to grow your balance sheet? Because you need to be able to invest for policy and economic change, and you also need to be able to train staff, and you need to be able to replace assets at the end of the day. So for medium and longer term sustainability, you must be making a profit. There's no case where a not-for-profit or charitable organisation shouldn't make a profit. And again, we saw that before in that previous slide. At the end of the day then, we use CPI as a proxy for economic growth. If you're not making a profit of equal to or greater than CPI, then your balance sheet's not keeping up with the change in the economy. So if you're making a profit of 1 or 2%, it's not good enough. You've got to get at least CPI greater to be able to ensure your balance sheet is building to be able to go forward. So that short, medium and long-term sustainability relates to your solvency in the first instance. Of course, you've got to pay your bills as and when they're due. But in the mid-term, you need stability, and that means you've got to pay things like long service leave and other costs associated with human resources and so on going forward. In the longer term, you need sustainability, which means you're able to replace your assets, you're able to train people, you're able to reorganise your organisation or to retrain or reset your organisation to meet policy changes and so on. You need funds to be able to do those things. This is what sustainability looks like over those terms. So sector providers can't maintain sustainability without a profit. If you're not making a profit, you are not sustainable. So what's the resolution for this? Firstly, I think there are three elements that need to be thought through, and this chart helps to define those elements. The first one is having a set of costs, a set of prices that actually reflect the comprehensive cost of service delivery. That includes depreciation, amortisation and other longer-term costs that need to be taken into consideration. We also need to see instances of capital injection into the sector when economic, policy or other changes occur, which mean at the end of the day, organisations have to reorganise the way they approach their operations. We need to see that capital go into the sector. And finally, we need an indexation structure that truly means the comprehensive cost of service delivery is going to be met at least on the 1st of July each financial year, if it's not met subsequently until the end of the financial year. All of those things need to be provided, but they need to be provided in a transparent way so that not only yourselves as people operating in the industry know what's going on and can have confidence in the finances going forward, but also so that the man in the street, the people in the street rather, can see what's going on and be able to respond according to or in the context of discussions around whether the NDIS is costing us too much or not. People, voters, can't really make that discernment at this point. So this report finishes up with a number of recommendations, and I'll spend the last minute looking at those recommendations. Firstly, we believe that we need to have a comprehensive contracting process that is demonstrably based on empirical evidence of cost and service mix requirements. We need to have transparency of the service mix needs, transparency of the service mix gap, and transparency over the cost of service delivery so that the price is connected to that. We need an indexation process that ensures the timely and full allocation of funding to cover the cost increase experience of contractor providers at least once per annum. We see the Australian Bureau of Statistics involved in this process to establish what we call a producer price index. The ABS already establishes each year at least a producer price index for mining, for building, for engineering, for a raft of different industries. There's no reason why they can't do it for this industry as well. And of course, having the ABS do it means it's arm's length from funders. Governments have to then be transparent in why they're not handing on what the ABS calculates as being an appropriate uplift. The third recommendation is a mature impact-based response to policy changes and social shifts and shocks by injecting levels of capital into the funded sector to ensure comprehensive cost of service delivery is fully met in a timely and effective manner. This includes in relation to investment for staff change, for training, as well as investment for things like IT requirements, relocation requirements and so on when government changes its policy framework. A comprehensive data asset development process will need to be established, so we'll ensure transparency over the extent to which service mix gap exists in Australian communities. Without understanding that service mix gap, we really can't go back to government and say more investment's required to be able to close that gap. The final point I'll make, and I've said the final point a couple of times now because I'm a good lecturer and that stops people packing up their books, but the final point I'll make is that the recent publication in November last year of the Not-for-Profit Sector Development Blueprint, which is a 10-year plan for the development of the charities and not-for-profit sector in Australia, was published in November. It includes 3 themes, so a bunch of initiatives, all sorts of initiatives, as you can imagine. But the first theme actually relates to the topic we've been talking about this morning, and that is that an enabling operational and regulatory environment for the NFP sector to survive, to thrive rather. At the end of the day, the kinds of things that I've been talking about fit under this heading. And so I would encourage the sector to be talking to the Commonwealth Government, to be talking to other governments about this being a development opportunity for the sector, about being a blueprint opportunity where we can actually have the rubber hit the road in terms of what needs to change to make this sector much more sustainable. And again, I thank the Catholic Social Services Australia for the opportunity to be able to produce this project and this report, because this is actually the first hit in our blueprint effort. And I think that's a really important consideration. Thanks very much. I'm happy to take questions.
Thank you, David. There is much for us to take away from that. Roving mics again. If there are questions from the floor, please raise your hand and the mics will find their way to you. One over this side, Ron.
Thank you, David, very much. And my name's Chris Heatbrink. I'm on the board of Centrecare New England Northwest, and we cover the best part of New South Wales, which is about almost 25% of the land, and we're remote, rural, remote and regional. So I've just got a couple of comments. The one person that mentioned outcomes was you, and it was just one word, and I think it's the thing that we all forget about. I've come out of the neighbourhood centre sector, and I've also volunteered with Vinnie's as a conference president, for many years. So I think we forget outcomes. Everyone's looking at outputs, and the outcome that some family is safe over 55 outputs is the most important thing. The other thing is the cost shifting that you talked about, but I think you failed to mention local government, and that's a huge area in our sector that we rely on, and ratepayers don't really like that. Yes. So governments shift the costs by not funding properly, and then people go back to local government, and then local government says no. So then you're just stuffed. You've got nowhere to go and people are unsafe. Duplicated services, I think we never look at, and we don't look at the collaborations that can happen between lots of organisations in the sector, not just Catholic organisations. They're in every town, everywhere. And in our little community of Tingha, which has something like 56 services into it, the duplications are extraordinary, and most people don't get to see those services. So there's this whole undercurrent of people earning salaries and travelling and no one getting support. And I think it's immoral, quite frankly. And the other thing that I just wanted to say, so there's really no questions, but the other thing I just want, following your humour, organisations in community who work in collaboration should really be valued, and they're not. And there are many, when you talk about the funding in millions, I work for an organisation where we functioned on $100,000 a year, and we could open 4 hours a day. So this doesn't service communities. Yes. But the last thing I want to say is thank you for making accounting interesting, because it was a very great presentation. So thank you very much.
Thanks very much. It's great to be able to give you a platform. I think there's a raft of things in what you've said. I agree with all of those things, and I think local government, there's many things I haven't spoken about, as you can imagine, and there's nothing you've said that I couldn't say that I wholeheartedly agree with. At the end of the day, I do think local government is one of the big things. So local governments don't have sovereignty in this country. This was one of the things that Julia Gillard was trying to rectify, you might recall, as one of the initiatives that she tried to deal with. What does that mean? It means that states and local governments are creatures of states and territory governments, and state and territory governments are very good at pushing responsibilities to local government, but not actually funding local government or allowing them even to raise rates as a result. So I think that's a really significant issue. The second issue is, yes, quasi-markets, or this discussion about markets, is bloody-minded, but it's absolutely wrong. We need cooperation, not just between organisations that are providing services, but between government and those organisations. Governments would get a lot more out of cooperating wholeheartedly with the sector. The sector and the community would get a lot more out of that as well, and there'd be far greater value for money as a result of that. So I think one of the big things that I haven't mentioned at this point relates to a problem as I see it, which is over the last 2 decades, policy responsibilities gradually drifted up the jurisdictional tree to the Commonwealth Government. Why is that? Well, the golden rule of business applies. What's the golden rule of business? The man with the gold makes the rules. And the Commonwealth has the gold. But we need to have decisions made at the local level, at the coalface, to be efficient. And there's plenty of academic evidence to show around the world that efficiency in terms of social service delivery occurs when decisions are made with the people that are actually enjoying those services or getting the benefit of those services, rather than trying to make those decisions in Canberra. So I know I haven't touched on everything that you've said, but all of those things are absolutely critical.
Thank you very much, Professor Gilchrist. Just in front of you, thank you. And thank you for your presentation, and sobering, but also reassuring, so we're not on our own. And however, and I do have two questions. My first question goes back to, this has been, we have recognised for a very long time the starvation cycle that's happening in the not-for-profit.
Yep.
It goes back, that term came out in 2009 with Stanford. You have written so eloquently over a number of years, because I've referred to your papers often when I'm meeting with government in the last 4 years. What's going to be different now is my first, I'll get my two questions out and then you have the floor. So what are we going to do differently now? Where's the momentum coming from? That not-for-profit paper and blueprint, I must admit I read it on my school, I was going to say school holidays, but my son's school holidays, I was on holidays. I found nothing enlightening about there. There was nothing new, and I've seen no difference since that was published in November. Yeah. So that my first question is about momentum. The second question is really important as well. So it was great in your research you included an organisation that had an income of 5 million. We've heard today of someone with massive geographic coverage with an income of 100,000 is what I heard. But it's these small organisations and their impact. How are they going to survive what you highlighted there, the IT costs, the regulation costs, the quality costs, etc. Yes. And we have a duty in this room to make sure they do survive, to advocate for them. So they're my two questions. Thank you, Professor, and thank you for the report.
My pleasure. So going back to the first element, I think at the end of the day, I think there are some really significant communications problems between the sector and the community. I think the sector's captured because many peak bodies are captured by the fact that governments support or fund those peak bodies, and I think that has an impact on the capacity of those peak bodies then to go to the community. My personal view, and this is the world according to David, and I'm sure everyone's got different views, but until the sector can create a political problem, politicians will not respond. Why is a politician going to create another problem? The Prime Minister's got an election coming up. It seems to me it's going to be a hard-fought election if the Prime Minister's government's to survive. He's got a whole lot of problems. Why is he going to add another problem that no one's talking to him about when he walks through a shopping centre? The sector's got to create a political problem. And it will never change. So I've been looking at this for 30 years and I just can't see how it can change unless we have a political problem. And it's easy for me at a university to say that. I get that. I'm not pretending it's easy, but I do think that's the crux of the issue. I think small organisations will fail. And so my problem is that we don't have transparency over the service mix gap, which means when an organisation fails, we simply don't know or realise that people are going without supports that they need to live their life. And we see that in the remote areas. The other lady was talking about northwest New South Wales. I've worked in the Kimberley in Western Australia, where our service patch was about 1,000 kilometres radius from Broome. So it was good to be in Broome, but 1,000 kilometres radius. Small organisations can't survive there. But if the small organisations fold up, there's no one there to hold the government to account for that. That's the reality. Without that service gap being transparent, we're not going to see that happen. So I think the short answer is we need to somehow go to the community and say this is a problem that's unacceptable and you should be worried about it. And the first port of call is, even if you're not concerned about the moral aspects of it, the economic aspects, this all costs government more because government doesn't support those cheap services provided by the social services sector, which means that primary healthcare has to pay. It costs the taxpayer one way or the other. We're actually offering a higher value for money, more efficient solution to the problem. But I think we need to communicate that. Of course.
So one of the ideas I we've seen the impact of oil emissions into various issues. Do we need, my voice definitely doesn't carry. So I was just introducing Josh Lorenz behind me. He's the head of our peak body in Victoria for our sector. Do we need a Royal Commission into the social services sector? Because I think it is a tragedy if we lose these smaller entities, because their impact is extraordinary. The way they can bring community. Josh is involved with the Brigidines, I'm just giving that as an example. They do incredible work for refugee and asylum seekers. If they are not supported, because I've had a look at their balance sheet, you know, it would be awful for particularly our newly arrived migrants in very tough times. So that was just my idea. Josh probably said, oh, I'm glad she's not coming to my office very often, but that was just one of the ideas.
Look, I can't see why you wouldn't. I think there is a real issue here. So when the NDIS was, we've done a lot of work on the NDIS, and one of the things that we predicted was that the NDIS failures would result in the sector being blamed. And I think that's largely what's occurred in the NDIS, is the sector's being blamed for being inefficient and so on and so forth. I think that is one of the risks of a Royal Commission, is that the sector doesn't come out as well as it might do. But I think whatever it takes to get a political agenda up as opposed to a policy agenda is really critical. And I'd certainly be happy to talk about a Royal Commission in that respect. Yeah.
We'll take two more, one from Kathy and one more adjacent table.
Thanks very much, David. Really interesting stuff. Kathy Utrich here from the Archdiocese of Brisbane. I do a lot of the government advocacy work, so all of this sort of stuff is pieces of work that I like to put in front of politicians when I'm trying to convince them to develop a policy or implement a policy. I'm just curious, though, with the sample that you use for this report, from 20 to 24, from those 7 case studies, majority of that time was COVID. So I'm just wondering if that had, or whether that might skew your findings at all, or whether you were able to identify the difference between 21 and possibly 22 as opposed to 23, 24. And the other thing I'd like to ask is just a clarification. By compliance and QA cost, does that include the amount of time spent on reporting into government bodies? Because we did, just anecdotally in our own organisation up in Brisbane quite a few years ago, that showed in one particular service delivery area that 63% of the time of our frontline clinicians was spent just reporting in instead of delivering services frontline.
Yes. So taking the last question first is the easiest one. Those costs reported were purely the over and above costs of staff time spent doing those things. So cases where organisations had to employ someone to be able to undertake the QA process, to train people, to oversee, to report and so on, as opposed to staff who are line staff collecting data or doing things that relate to the QA process rather than to the delivery of care. So that's an understatement, if anything. With regard to administrative and regulatory costs, it's everything from audit through to ACNC, AIS statement lodgement and all of those kinds of things. Audit is certainly something to look out for the sector, because there's a big demographic change in the audit community where auditors are retiring, and getting hold of auditors is going to be increasingly a problem. And of course, what does that mean? Supply and demand means the costs go up as well. So we're predicting that costs like audit and so on will go up accordingly. Sorry, what was your first question? I'm just... COVID. Oh, sorry, yes. Yeah, that's why we initially weren't going to wait for the 2024 data to come out, but that's why we did wait. What we found actually that there was no real discernible differences across those 7 cases. And again, there's 7 cases, but we also did some work for Northern Territory, which we're going to publish in a couple of weeks' time, and that work did a similar review of the population, and we see minimal impacts of COVID on that population of organisations up there. So we kind of think that there's some impact, but it's not an impact that really discernibly changes the data.
One final question.
Okay, so thank you very much. You've talked about efficiency as not being cheap, but what efficiency also means is generating a positive sum outcome. And you've pointed out very correctly an alarming signal that smaller institutions are in danger. However, there is the possibility of greater cooperation among smaller groups, so that synergy, a positive sum outcome if they work together despite government constraints, can succeed. And I've seen miracles happening from cooperatives, from grassroots organizations and enterprises in the most remote areas. Shouldn't we also be exploring that option as well in order to save the small endangered organizations and endeavors? Thank you.
Yes. Efficiency is a really, really important economic idea that the sector needs to come to grips with. I'm not answering your question, but I'll come back to answer it if I may. Economic efficiency relates to our universal desire in the economy to increase the productivity of people. And so in economics terms, there's already in this last year been discussion from the central bank and discussion from economists saying that this sector is not efficient enough. It's not efficient because it's human resources intensive. And so I think this is an area that we really need to discuss deeply and think about what the response to economists is going to be in relation to efficiency. And I'm happy to do that out of session and talk about that more deeply as well. But I think in relation to cooperation, I simply agree with you. I think talking markets is ridiculous for this sector. There isn't a market. There's reason government gets involved is because there isn't a market. There aren't hundreds of listed entities selling social services in the Australian market because there's not financial capacity to do that. So we've got to stop talking about markets. I'd love to stop talking about prices, and I'd love to start talking about localised issues and social service needs and how we apply resources to meeting those needs with a combination of organisations, so charities and not-for-profits working together, but also governments working with those groups as well to be able to put forward the right processes, the right combination to achieve an outcome. I think that's it. Thank you.
David, thank you for launching the report and sharing so much of that with us today. One of the takeaways for me was around sustainability and the critical nature of it, the complexity of it, the challenges to it, and the responsibility which needs to be taken by government and agencies in addressing it. Thank you for sharing with us today. I also particularly picked up on your important distinction between efficiency and cheapness, and I particularly hope that your other reference to being inclusive of hot and cold running champagne is particularly applied around efficiency and cheapness.
Thank you.
And put our hands together to acknowledge David again. Thank you for what has been a very productive and engaging morning. We will now adjourn to lunch. If we could be back at tables sharpish for a 1:30 start. Thank you.